Good evening. It would be a public health nightmare, a deadly disease, crossing borders, and perhaps moving beyond containment. And tonight, that's just what health officials are worried they might be facing. Just one day after a mystery flu appeared in the U.S. and Mexico, there are already signs that the situation is far more dangerous and widespread. Tonight, Mexican health officials say at least 60 people may have died, and at least 1,000 more are ill. There was also confirmation today that some of those cases are swine flu, the same virus that's being detected in the U.S. We have a lot to talk about tonight, including what swine flu is and how concerned you need to be. But we begin with the day's news and Joanna Remiliotis. Joanna.
Peter, even though there are still a lot of questions about this mystery virus, everyone is on high alert.
As a deadly outbreak continued to spread in Mexico, so did a sense of alarm. Classes for millions of children were canceled. Hundreds lined up in front of hospitals, worried the mystery virus might hit them next. And it is a migrating bug. The deaths in Mexico have been linked to a strain of swine flu also identified in 8 people in California and Texas. U.S. health officials are not calling this a pandemic, but it does show the signs of one, a deadly new virus with the potential to spread quickly between people.
We do not know whether this swine flu virus or some other influenza virus will lead to the next pandemic. However, scientists around the world continue to monitor the virus and take its threat seriously.
Canada's top laboratory made the link between the outbreaks in Mexico and the U.S. after experts analyzed several samples from Mexico. Samples from Canadians who recently returned from Mexico are undergoing further testing.
There's a handful that are being looked at across the country. That number will vary every day. Most of those, if not all, actually, and so far none have turned out to be this particular virus.
The swine virus identified in the U.S. and Mexico is a new one. The American patients had no contact with pigs. All are doing well and responded to existing antiviral drugs. But part of the mystery is why the same virus has killed previously healthy young Mexicans.
It's really critically important we learn more about what's going on in Mexico.
Experts believe the numbers will rise in Mexico and in the U.S. as more people are diagnosed. And many fully expect the virus will appear in Canada too. 190,000 people arrive from Mexico City alone to Canada every year.
Depending on how events unfold.
Dr. Cameron Can studies flight patterns and determines risk areas. The virus, he says, is most likely to show up in 3 Canadian cities.
85% of Canada's risk exists at 3 points. Toronto, which is about 35%, Vancouver 25%, and Montreal 25%.
It's why health officials in Ontario are already preparing for a pandemic.
We're already assuming that is the most likely course of action. So it's not like we're sitting here saying, well, we won't do anything until WHO makes an announcement.
The World Health Organization is convening an emergency meeting to determine whether the outbreak is an international health risk. If that's the case, the organization says it will use rapid measures to contain the virus. Peter?
All right, Joanna, thanks very much. Joanna Remiliotis in Toronto tonight.